Thank you, and thank you for your courtesy, Senator Murphy. And again, welcome, Doctor. Welcome to your family. Service is a family affair, and we very much appreciate your family's support, not only in this endeavor, but in all the work you've already done. We can't overstate the importance of the FDA Commissioner as an advocate for public health, and as you've heard from all of us, fact-based decision-making, particularly at a time when we continue to grapple with the devastating impact of the opioid epidemic and the surge in youth e-cigarette use. Dr. Hahn, as we discussed in my office last week, 8 months ago, Senator Markey and I sent a letter to the FDA asking basic questions about the approval and labeling of opioids, including the influence that drug manufacturers had on these decisions. We also asked in that letter about a problematic clinical trial design that FDA allows for opioid approvals. It's called the Enriched Enrollment Randomized Withdrawal Study Design, which is a mouthful, and some experts and some non-experts like me think skew the results. As you know, FDA has not responded to our letter. This committee has a track record of working on a bipartisan basis to address the devastating opioid crisis, and we need FDA to be a partner in those efforts. That includes being responsive to and transparent with members of this committee. I heard what you said in your opening statement in response to other senators here about working with Congress. So my question to you is asking for the same commitment from you today that you gave to me in my office last week. If confirmed, will you respond to our letter within the first 30 days of your tenure?
Senator, as I said in your office, and I commit to this, within 30 days, I will look into this issue and get back to you regarding your letter. I also want to emphasize, Senator, that I very much appreciate your approach here, and that is it's always important to have a look back to see what happened, to see if you can have continuous improvement. I think that's a really strong effort.
Well, I appreciate that, and I take it from your answer that your update on the response will include specifics on where the response is held up and why, if you can't get me a full response.
Yes, Senator.
Because a look back isn't particularly helpful if it takes too long to do, right?
Yes, Senator.
Okay. I also appreciated our discussion in my office about balancing access to opioids for those who need them with policies that keep these highly addictive drugs from being overprescribed. Can you talk about how your views on opioids have evolved since medical school and how marketing efforts by opioid manufacturers may have influenced physicians' and patients' initial understanding of the dangers of opioids?
Senator, yes, thank you for the question. And it's a really interesting time in medicine regarding this issue. And congratulations to Congress for their excellent work as well as the administration on this, because provider education has gone a long way to addressing the problems that we've seen. I mentioned in your office that when I first went to medical school and started taking care of cancer patients, the teaching was that cancer patients should be treated liberally with opioids and that they don't become addicted to pain medications. And we found out that that wasn't the case, and with in some instances, tragic consequences. We've totally changed based upon new information and education how we provide relief of pain for cancer patients. And as you can imagine, as a cancer doctor in the front lines, this balance between relieving suffering but also making sure there's not misuse or abuse is critically important. So a multidisciplinary approach has been instituted at MD Anderson, as we talked about, with certainly opioid therapy, but also non-opioid therapies, behavioral therapies, even potentially medical devices to help with pain. I'm very much a supporter of the multidisciplinary approach to treating pain. I think it's something that we need to do more of. And if I'm fortunate enough to be confirmed as Commissioner of Food and Drugs, I look forward to furthering the education efforts for providers and patients.
All right. Well, thank you for that. And I appreciated that conversation, and I look forward to you continuing to take that hard look at that risk-benefit analysis of these kinds of drugs and what they should be used for and what they shouldn't be. You have heard a lot of concern up here about fact-based decision-making, about the influence of outside interests, whether they're special interests or ideological ones, on decision-making at the FDA. Right now, we are dealing with reports that the administration caved to special interests in reversing the e-cigarette flavor ban, and that's incredibly disturbing. You've talked a little bit about your concerns about the ban, but if you are confirmed, you're going to be overseeing the FDA pre-market tobacco application process for e-cigarettes. a whole lot of people are counting on the FDA to put public health first. Will you commit to public disclosure of all meetings between FDA and Juul that take place before and during the pre-market tobacco application process, including who attended and what was discussed? And will you commit to providing this committee with any data you receive from companies like Juul that relate to youth e-cigarette use, including data on flavors and diversion?
Senator, so I am aware of the pathways that you're describing. I think they're important, and I do think they need to be supported by science and data and congruent with the law. What I can promise you, Senator, because I'm not at the FDA, I don't know the rules and regulation around disclosure, that I will look into that, understand what those rules are, and follow the law.
Well, and just for the record here, Juul made a commitment that they weren't going to lobby on this. And then their representatives come to my office and mention all the meetings they've had at the FDA. And when I asked the FDA about what meetings they had, they said nothing to do with policy. They're either lobbying or they're not. And the American public has a right to know how decisions that affect their children and our public health are made. And so I am very hopeful that we will get full disclosure from the FDA about their meetings with Juul and the information Juul has brought forward. It was an issue with opioid approval as well, and I thank you, Mr. Chair, for letting me go over.